first of the new term, so you've got your new school bags and pencil cases, and freshly pressed blazers or whatever it is. My kids went off with those this term. It does feel like the start of something new. It does feel like a really sort of exciting a new time for us, not just at AWRC, but I think more broadly. And so it's lovely to see so many of you and get us together. And the kind of first agenda item really is just to hear from as many of you who want to share what you've been up to over the summer, any good news stories, professional or personal. And I'd love to just to spend a few minutes hearing from the folk that make up the AWRC. You all come from all different parts of the organisation and the institution, and we're rapidly growing. I think, Claire, at the last count, we're now well over 100 co-locators, and I'll say a bit more about how we've grown in the update bit. But does anybody have any or would like to share any kind of good news stories from over the summer, just before we jump into the agenda? There must be some good news, surely. People can wave at me and.
Rob, I'll go in. Oh, Claire's got her hand up, I think.
Great. Steve, you go, and then Shona.
Oh, look at that hat.
I thought I was going to make the most of the last 2 hours of the summer, because it's going to lightning tomorrow. So I've sent it round to a few people, but over the summer I got coerced into putting in a bid with some people from AWRC and the Sheffield Teaching Hospitals, and this bid was about a future hospital, hospital of the future, and it was a Wolfson Foundation economics prize. And the idea was that people put bids in, and the winner gets, I think it was £150,000 to kind of develop their idea. So we didn't get through to that top prize, and neither did we get the other 5 prizes of 5,000 for something or other. But we got this light bulb award, and the light bulb award, and the idea was a little bit out there, but the idea was, how do you convert existing retail stores like Debenhams or Cole Brothers into an outpatients hospital? So given that city centres have the best lines of communication, and we've got lots of city centre kind of retail space unused, with cellars and ground floors which are actually perfect for things like scanning facilities, etc. So we came up with a design, and we got a light bulb award, which meant that we didn't get one of the main prizes, but they liked it so much that they wanted to flag it up. So we're now going to take that idea, and we're going to kind of run with it and see where it takes us, whether we can get the City Council, Sheffield region interested in doing something which links outpatients, Move More, AWRC. You kind of can guess where that might go. Anyway, so I thought that was quite a nice story. Really yeah. Anyway, it's fun.
That's brilliant. That's brilliant, Steve. And I'm glad to see you're outside as well. You and Anna definitely win the prize for making the most of summer. So that's good stuff. Claire, and then Shona.
Is that you, Claire?
Which Claire?
I was going to say which one, because neither me or Claire had a hand up. So.
Oh, right. Okay. Sorry. That must be waving at the camera then.
It was Claire Woodward's hand. So Claire Woodward has about 8 people on it. The hand went up, so somebody pressed it.
Oh, okay.
Right. Still people in there. Yeah.
Well, whilst you're thinking, well, Shona, we'll come to you. What's your
hand up?
First, I'd like to say that I think that idea that Steve got dragged into is actually brilliant, for a whole variety of reasons, transport, etc. And if you can restrict yourself to not just STH's outpatient and community care services, but to the stuff that the local ICS needs to run in for community care provision and physiotherapy, PhysioWorks, all of that kind of thing. I think that's an absolutely brilliant idea. I've been brought in by Chris Lowe to work on the development of a new simulation training center for general practice, but it's actually going to, well, we're still at the point of defining the edges of general practice, but they do keep talking about community services and that kind of stuff, which fits with our remit as well. And it's been it's not the first time in my life I've been involved in designing a building from scratch and making all of the conflicting, because they don't know they're conflicting when they start, visions pull together and produce a final product. And then, but what we will be doing from the SHU perspective is we are the experts on both the evaluation, which will be embedded from the beginning and not just added on after and not have enough data, and also Mel Lindley will be involved in the simulation and the specialist teaching methods that are going to be involved with that. So I suspect parts of it might become relevant to us if we need to have some kind of simulation training center for some of the stuff we're doing. So keep it in mind. It's I have to say, the enthusiasm is really interesting, and it's going to become a test case for multidisciplinary working amongst the new ICS. So
Brilliant.
This should be fun.
Brilliant. Thanks, Shona. Anna?
Hi everyone. Yeah, my good news story is just a bit of an update on Beat the Street, actually, because I know we had a lot of very keen competitors on the call, and the 6-week game finished over the summer holidays. So we've now got some preliminary data back, and our aim was to have around 40,000 people across the city playing, and we ended up with more than 60,000. So that was really great. And one of the really pleasing things was that we demonstrated reverse equity in terms of who played. So when you look at quintiles of deprivation across the city, the most deprived quintile had the greatest proportion of players. So as I can see Shona cheering there. Yeah, really nice good news story, lots of fun to play, and we're now just collecting the data and working with Intelligent Health to make sense of all of that.
Can I ask what Intelligent Health is?
Oh yeah, it's the organisation that sits behind Beat the Street is their product, and Intelligent Health is the organisation that sits behind it. It's led by Dr. William Bird, who you might have come across.
I think so. Yeah. Okay.
Brilliant. Thanks, Anna. Thanks, Anna. I'm going to just share a good news story if I can, selfishly. So over the summer, we completed the recruitment for our Active Together programme, which is the Yorkshire Cancer Research Prehabilitation and Rehabilitation programme to support people with a cancer diagnosis. And it's great to be able to say we've got Gail Phillips and Katie Evans, Mike Thalwell, who've joined that team on the call. We've also got Gabby Frith, who will be joining the team. Oh, Gabby's on the call as well, and Katie Pickering will be joining as well, who might be hiding behind the New Day thing, I'm guessing. So it's been a long time in the planning, and we've now got a fantastic team to be able to deliver that project. And I'm sure we'll have an opportunity at the next Colocators meeting to perhaps introduce that team, and they can share a little bit about the project and how they're getting on with it in due course. Thanks, Katie. And that kind of, has anybody got any other, have I missed anything in the chat?
Can I just do a quick reflection on the Olympics?
Yes, Sam, of course.
Okay,
yeah.
So I know the reason why I asked the question is I know Amanda covered it at the last co-locator meeting. I think Tokyo was just on, but for those of you who don't know my group, we had the most successful Olympics ever. For us, we always judge our contribution on how many medals we've helped Team GB win. We increased the number of sports we helped. There's 11 sports this year. This Olympic cycle at Tokyo. A number of medals was 41 medals that we helped Team GB win. We work really closely with boxing, swimming, taekwondo, lots of other sports. We helped swimming have their most successful Olympics ever, and boxing have the most successful Olympics in the last 100 years. We provide data management solutions and all different analysis techniques, helping the starts and turns of swimmers, etc. That was supposed to be a summary, because the bit that I wanted to get onto was actually what I observed after the Olympics, which was athletes proactively advocating their sport and showing how, evidencing how members of the public had spoken to them, reached out to them on Twitter, saying thank you. You know, your fantastic performances have inspired my child to pick up their BMX and head down the BMX track or go down the swimming pool. And the specific thing that I wanted to raise was how the athletes themselves were raising the profile of the sport and promoting physical activity. I'd not noticed that in the previous Olympics. And an extra reflection on that is that how fantastic would it be in, say, 4 years' time, in 8 years' time, if we were actually to look back on the investment, the National Lottery investment in elite sport, and see it as one of the best ever and one of the greatest ever and most impactful investments in public health and well-being, rather than seeing it at the moment as just been around elite sport. A huge investment for the National Lottery. And let's, like I say, how fantastic it would be if we did reflect back in 8 years in terms of the impact that these athletes have on the public health of the nation. So, sorry, it was a bit longer-winded, Rob, than lots to cover there. We saw that to Adam Peaty in terms of the usage of swimming pools. The usage of swimming pools did go up straight after the Olympics. Whether you can directly associate that with Olympic success is difficult. But
well, it's the value of the demonstration effect, I think, that
that's it.
Simon might, Sibyl will know a lot more about, I think, in these contexts.
Yeah, I was going to say Simon's group, yeah.
Yeah. Simon, one quick question before I bring Jason in, because I know he's got his hand up. How was your medal prediction this year, Simon? I know every year you kind of suggest what the medal count might be. Did you get anywhere close this year?
Oh, thanks, Rob. It's a good story. I have made medal predictions at the Olympic Games since Beijing. And for London, well, for Beijing and for London, I was out by 2. So I think I said for London, we would win 27 gold medals, and we actually won 29. And people said I was mad, but obviously I wasn't mad enough. But I then got introduced on radio, Sheffield, as this guy is the Mystic Meg of the medals table. So I thought it's time to reinvent myself. And I didn't do a prediction for Tokyo, but I did supervise a dissertation student who did, a guy called James Longbottom. And using the model that I devised and a bit of thought and what have you, James came up with a forecast that Japan would win 27 gold medals. And if you look up in the table, I think you'll find Japan won 27 gold medals. So I've passed the baton on, Rob.
Good work, and it well and truly not dropped, I think, which is good. Brilliant. Thanks, Simon. Jace, last word over to you before we move on.
Cool. Afternoon all. Hope everybody's well. Nice to see everybody. Just a quick piece of good news around funding. Actually, we've for a good number of months now, we've been talking to a company called Intermedi Group to look at some further follow-on funding for the next phase accelerator, which will actually start bringing on its next cohort into next year. But we'll be starting marketing for this thing around about November time this year. The good news is we've managed to secure £150,000, which we've been talking about for quite some time with them now. So we're in a meeting with the university IP in summer, and with 2 senior people from Intermedi Group, and they've recommitted to that funding. So they're just looking at the contract as we speak, which University Legals helped us draw up, but pretty much everything should be in place to start for that funding next year. Now, what's interesting about that, it's directly been set up not to fund infrastructure or admin support or anything like that. It's literally designed to fund research. So that whole £150,000 will be going towards funding Sheffield Hallam University researchers. So good bit of news for you there before we get into the meat of the event.
Brilliant. Thanks, Thanks, Jason. If anybody wants any additional information about how they can get involved in the delivery of some of the R&D, then Jason's the man to have a conversation about.
Jeff, you're not in this meeting. Colocators meeting. We're all supposed to be there, I think.
I'm just going to mute you, Ben. It's good to have you. I'm going to just move on. One quick thing. I'm going to Simon Shibley, I've dropped you a note in the chat just about your session, whether you'll be able to hang on till 3:30. Just we've moved the agenda around a touch. Okay, brilliant. So I'm just going to move on to agenda item 3, which is what's new at the AWRC. And before I hand over to Claire Woodward, Claire's going to take us through just a few updates in terms of our policies and practices that we have on site. I really wanted to just say, as we've grown as co-locators, I think I want to note that it's absolutely brilliant to have Crazer, Ed and the team on site, and I genuinely can't tell you how exciting it's been for me to walk in today into the office particularly and see people in and around the building. It just brings the place to life. That, you know, it's just a building, it's just 4 walls until you put people in here that connect and co-locate and share ideas. I know it's very early days and it's new for you and your group, but I'm genuinely excited to have you for here as long as you are here. And this place is, you're very welcome at the AWRC. It's great to have you and colleagues from Crazer on board, and equally to have some of the co-locators back on site. We are open. We want to kind of encourage this to be a place where people can come and connect and meet and share work together. I've certainly benefited over the last few weeks of just being on site. It's felt like I'm contributing to something that's bigger than my own workload by connecting with others. And so as you feel more comfortable to come on back on site, this is definitely a place where I'd want you to feel welcome. And in that, I've had so many comments back. I know they're not on the call, but so many comments from folk about the reception staff and the estate staffs, just saying how welcome people feel as a result of that. And so on their behalf, I want to say thank you for that response, and I'll let them know just what a fantastic job they're doing in making this a place where people feel welcome. So that's what I wanted to say on that. And Claire, if you're ready, I'm going to just hand over to you. I know we've got in due course Amanda taking. I wanted to just particularly say a thank you to you for stepping in and filling in the gap around operations with support from Claire and the wider team as we move towards the new appointment of Amanda. But you've done a fantastic job and continue to keep us on the straight and narrow with COVID and the processes. So thanks, Claire, for the hard work that you've done. And I'll hand over to you just to give us a bit of an update on where we are.
Thanks a lot, Rob. I'm at middle at table waving if you can't see me on there. So it's lovely to be in here today in this room with lots of other people in here as well. And as Rob's just mentioned, we've had it's busiest I've ever seen it in building. I think today Claire did a bit of a quick count up when we came back at lunchtime, and with the staff that we've got on site today, with the clinicians that we've got children's hospital clinics running today. We've got STH running pulmonary cardiac rehab sessions today. So with all their patients and everybody, we probably had over 100 people move through the building today, which is just fantastic. So it's what we're here for. So yeah, really great stuff. So I have got some slides to show you. It's sort of grown a little bit more than we originally planned, so I will crack on with those. And then if anybody's got any questions, if you want to ask at the end, if that's all right, just because I won't be able to see you while we're sharing the screen. So, oh, okay, that's
advanced.
interesting.
Is it advanced?
That's it.
Advanced. No. Does the PowerPoint have to be showing?
It's there.
Yeah, just pop it up and then now go back.
All right, okay. So sorry, technical issues at this end. That's not ideal.
Try it again.
Try again. Where am I? Yeah. Oh, okay.
Listening.
Well, let me share my screen and then see if I can share the PowerPoint. Can you see the PowerPoint?
Yes.
You can see that.
Yes.
Yeah.
Oh, fantastic. Okay, it does work. Okay, super. Right. So actually, one thing I just quickly wanted to just say is there are a couple of faces on the meeting that you won't have seen before. So we are joined today by Catherine Williams and Greg Bryan, and they are the co-chairs for the next public involvement in research group meeting. So as co-chairs, we've invited them along today so they can get a better idea of what we're all about at the AWRC. So welcome to you both to the meeting. Okay, so we'll start off with the operations update in terms of COVID safe. So as Rob, when he sent his last message out about this, we said we'd review the situation on the 1st of September. So along with all the university guidelines, we've taken everything into account and just how this will work at AWRC. So because we have participants and we have patients on site, but also just generally to keep staff safe, we would request that all people coming on site do continue to wear a face covering when you're moving around the building. That's also consistent across the other shoe estate as well. Obviously, when you're sat working and that sort of thing, you know, feel free if you feel comfortable to take your face covering off. We'd say where possible, continue to social distance. So you can see we've tried to spread out in here today. The room limits in labs and meeting rooms have been removed, again in line with central policy. But again, we just ask you just to be conscious of other people, because people feel differently when they come in, especially if they've not been on site for quite some time. So try not to overcrowd those spaces if you can. On the desks, the stickers have been removed. So again, we just say, if you're choosing a desk, if somebody's already sat on the desk next to them, just make sure they're all right with you sitting next to them if you wish to do so. Again, if you're hosting guests and visitors, we'd ask you just to ask them to wear a mask if possible when they're walking around the building. Before you return to campus, you still need to have a one-to-one with your line manager. And we still are asking for, well, centrally they're asking for you to continue to send risk assessments to health and safety for review. And again, project sign off now, we're just saying that's at your manager's discretion. So as Rob mentioned, we're open for business, the lab spaces are open. So we look forward to welcoming people back on site and to really get things moving up again. So I'll just move on to the next one. Okay, so in terms of access to the building, you've all probably got used to the system of filling the form in now to request access. We've changed things up a little bit. So Ian and Sarah have been working really hard in the background to get us onto a system called Connect2. So Connect2 is used by TORs across the university, in other areas of the university, to manage mainly equipment and equipment bookings, but we are also using it for booking lab spaces, meeting rooms and desks, as well as equipment at the AWRC. So it means that you've got a one-stop shop to be able to book anything that you need on site. So these slides will be going out after the meeting. So there's a link there to connect to. Ian has also recorded a screencast, which is really great because that talks you through step by step how to book, how to check availability, how to amend your bookings, how to cancel your bookings. If you have got any issues, if you want to just drop Ian a line, he'll be able to help. But it is really straightforward. But like I said, you do need to use that system now, as from now, rather than the filling the forms in. As co-locators, you've all been added to the system. If you book something and then are not able to come on site any longer, please could you cancel your booking, because we are getting people wanting requests and using spaces at the same time. So it'll be good because then people can then fill those gaps in. When you come on site we still ask if you can just sign in and sign out, just so we've got an awareness of who's in the building, and especially for at night when it comes to locking up, we sort of see who we need to throw out at the end of the day. So that's really useful. So again, any questions, just let us know about this, but all future bookings now through the Connect2 system. Okay. So, a few reminders. It's been a while since some of you will have been on site, so I thought it'd be just good timing, and just from some of the feedback that we've had from people who have been on site recently, it'd be good just to run through a few of these things. So just a reminder, the building is open from 7 in the morning to 7 at night, but to allow for the building to be locked up, we request that everybody, so staff, patients, visitors, participants, are all requested to leave site by 6:30 so that the building can be locked up. We ask for that staff don't arrive on site before 7:45. That's when reception staff arrive, and also because they'll be cleaning corridors and stairs and things like that, so it does make it easier for the cleaning staff to work. And just to make you aware that cleaning will be continuing later into the day, so it might be that there's people working around you while they're cleaning. Reception, like I say, is open from 7:45 until 6 o'clock. So if you've got patients or participants coming on site, we would ask you to have those appointments during that time, so we've not just got people wandering in and not knowing where they're going. If you're expecting any visitors, it's just useful if you can just let reception know, just so they know when somebody comes in who they're here to see, and they can ask them to take a seat. And then if you want any other arrangements in place, they just speak to reception and we can sort that out for you. Any visitors that are outside of those times that's unavoidable, they will need to be met directly by yourselves. Okay, so refreshments. Tea, coffee, sugar, milk, anything that you're wanting to drink. Just a reminder again that they are brought in by individuals. So if you are having hot drinks, not from the machine, can you please bring in your own supplies? We have been having some people's items disappearing on the days that they're not here. So we can just ask for people to do that. That'd be great. Again, just a courtesy one really, but if you've got any leftover food or leftover bits of milk in bottles and you're not going to be here for a while, can you please just throw those out? Otherwise it's not necessarily that nice when things are looking a bit green in the fridge, so that'd be great too. And as you had said, there's a lot of co-locators now, so especially people just coming in for odd date, might be then a while before you're in again, so just to look after that. If you are having external visitors on site, so non-shoe staff, we do have tokens that are available for the coffee machine. So you can request those rather than having to pay for drinks yourselves. If you're having a large number of visitors, we can facilitate that as well, because we have got big urns and we have got other tea and coffee supplies. So you just need to let us know when you make your booking on Connect 2, or at a later date, if you email AWRC operations, we can sort that out for you. Moving on to swipe card access, all co-locators staff cards should now be working and have access. But again, if you've got any issues, just email AWRC operations. We don't have that many visitor passes on site, so can we just ask, and it's difficult when you've not been coming and you have to pack all your things up and remember everything to bring on site, but if you can bring your own staff card, that just takes the burden off the limited number of passes that we do have. And if you do one, if you can just try and remember to hand it in when you leave, although reception can be a bit like little bulldogs with that, so they will chase you out of the building if you don't hand it in. So. Okay, communal spaces, again, just a bit of a courtesy thing. The Forge is not a working space, so if we can we ask that that's not used for virtual meetings or confidential meetings, because people want to be able to go in there and feel like they're free to have a chat and eat the lunch and just relax a bit away from the desks and away from work. Spaces such as the hubs, you can use those, but we obviously can't guarantee that they're going to be exclusive use or private use. And we are aware that the more hybrid meetings and things like that, this is potentially an issue with people trying to find places to be able to take these calls, but it is something that's been looked at centrally, and so we are liaising with that team there. Quick update on the roof terrace. The leak has been fixed at last today, so we're hoping we should be able to get out there again soon. The contractor is coming to relay the living roof and remove all the rubbish in due course. So you never know, although it's not going to be done for this last few hours of sunshine today, so we might have to wait until the sun arrives again next year, but we'll see. Physical activity suite, planning is underway. We're looking at options now for staff usage, because I know quite a few people are quite keen to get in there and be able to use that. We do, of course, obviously need to balance that up with the availability for the research and for clinical use. So we will keep you updated, so watch this space. And you're all probably fed up hearing my voice now, but we've not got too much further to go. Parking. So now, yeah, the college is back next door. We've had a lovely summer where it didn't matter what time you turned up, you could get your car parked in the car park. That's not the case anymore. If you get here slightly later, you'll probably find that the car park next to us is actually full. We are still working with the allocated contractors to be able to implement a system where half of the spaces are marked out for shoe, and some of those will be prioritised for NHS and participants as well, to make sure we've got access. We're looking at having another curb lowered so it makes access easier near the building. The car park at the far end of the running track, that does generally have quite a bit of space on there. And I have to say, because otherwise I'll be in trouble with Steve, don't forget you can actively travel to the AWRC as well. So we obviously we have the cycle store and that sort of thing. Just quickly, one thing I didn't put on the slides, if you are cycling, please do park your bike in the cycle store. We did have a bit of an incident a couple of weeks ago where a bike was outside and somebody did attempt to take that in broad daylight. So please do use that space if you can. That's to keep your bike safe. Printing, there's currently an issue. It's been reported quite some time ago now. We're waiting for IT to come up with a solution. I'm not quite sure exactly what it is, but they, if you're sending something from your laptop, you can print. If you're sending something from a desktop, it's not working. There is a workaround solution. It's not that straightforward. And I know Shona will say she'd had problems with it the other day.
I solved it. You send an email to the printer, which is weird.
Yeah.
And then it sends you a, did you really mean this? And you respond to that. And what happened is that a lot of us, me included, have multiple emails, and I don't know how it picks the one that it picked, but it picked one that I can't get rid of and I never look at anymore. Oh, so just check all your emails. It'll be in there somewhere.
Oh, okay.
Yeah.
So we'll send guidance on that after the meeting as well. The new printer name has been around a little while now, but if you've not been on site, the new printer name is now paper cut. So that's the option you're looking for when you do print. And can we just ask that if you only send printing to be done by the reception team, if it's sort of urgent or by exception, just because of their capacity really to be away from the reception desk. Okay, nearly there. Okay, so desk and lighting. So if you've been on site, you'll see that the desks on floor 4 and 5, they did have big stickers on which one you could use. They obviously have gone now from the social distancing point of view, but on the bottom left corner of each one, all those desks have been actually checked, all the equipment's there, they're working, and it'll tell you whether it's just a desktop or whether it has a dock to attach your laptop to get on the screens. So I'd say recommend if you've got this space using one of those. Some of the other desks don't necessarily haven't necessarily had that full setup redone since we've come back on site. It is in the list of things that we're going to look at. We have requested docs from Central, but I think we'll probably be down the list because they are prioritising all the central city buildings first. But that is the direction that they're moving anyway. If you do connect via the HDMI cable, if you just press the button on the side of the dock, it switches from the desktop to the laptop input. The guidance that's due to come out shortly from Central is they're recommending that everybody does bring their laptops in and work from those and bring headsets for any online activity. If you do require a headset, you can do that via speaking to your line manager and they'll be able to order one for you. Okay, so I've just sneakily snuck this one in because technically it's not an operational update, but as the coordinator for the PEG group, I just wanted to remind everybody now you're coming back from summer that the PEG is there and we do exist and we want to help you with your research, to inform and support the development of your research. It has been very quiet over the last few months with projects coming through, although we have got 3 to review during our meetings coming up shortly. But yeah, we get really good feedback. We can really help if you want to have a chat about anything, see whether you think it's suitable or not. just drop me a line. We can have a chat with it. So again, it's the links on the slide. We've updated the web page as well, just to give you a bit of more information. Yeah, please do use the service and keep Greg and Catherine busy, and the rest of the guys on the group. Okay, I promise we're nearly there. Just a really quick one: fire, first aid, and DSE. So again, some more information coming from Central. There's a new online fire safety course being trialled with some professional services staff at the moment. Now we've moved to this working model, and not the fire marshals might not necessarily be in all the time. It's a chance to do some training to make people more confident acting as fire marshals. So they're going to ideally want all staff to be able to do that. Professional services staff can book now, and it is due to be rolled out further to academics from October onwards. Professional services staff can also book onto their new first aid training course via core, because again, they're trying to encourage more people to be confident with that. Being condiment though, that's a good spell check there, isn't it? I didn't spell that one. You'll have a professional in Amanda soon, so don't worry. Yeah, you'll be more confident at choosing which condiment to have on your hot dogs. DSE assessment, that responsibility sits with your line managers. So if you speak to them, if you've got any concerns or any questions, that's totally thrown me now. Right, okay, so a couple of fun things coming up. Our wonderful colleagues at Crazer are bringing cake with them, and I know from working in the science park for a number of years in the office above where they were, every year they used to do a fantastic coffee morning selling wonderful cakes for Macmillan Cancer Research for the biggest coffee morning. So put the date in your diaries. I know Melissa is keen to recruit people to do some baking as well, but if you are not going to be baking, please do come and buy some cakes on the day, because I can definitely recommend those. Another fun one, once you've eaten all that cake, you might want to do a bit of exercise. So we are starting a badminton club. Provisionally, the day is being set on Wednesdays. We're going to look at a start date to be confirmed. We've just ordered the equipment. If you're interested, if you just want to drop me an email, from the interest I've had so far, I think we might need 2 teams. One, what's on my level, just come in, have a bit of fun, probably spend more time picking shuttlecock up off the floor, and the others who are a bit more professional with it and probably want to have a super league or something like that. But everybody is welcome, and it'll be a great chance to use the MAL for some slightly different activity. And that's it. I thought there were another one, I don't know why, but that is it. So I'll stop sharing. Thanks. So now I've just talked at you all forever. Has anybody got any questions?
So is Crazer actually joining us?
Yeah, they're here. Yeah.
Oh, okay. So they moved over. So never mind. Somebody tell me how you handled the data security problem.
Can we
do that off?
Do that to another meeting, because we've only got.
No. Just do it offline. Okay.
Yeah.
Off this.
Yeah. Any other questions for Claire on that? I think we're all going to leave thinking cake and badminton club. So yeah, that's,
condiments.
Yeah.
Condiments. Yeah,
condiments.
Don't get your condiments.
Cake and badminton club. Yeah. Just to echo the support from the PERG. Yeah, really, it's really invaluable. I've gone through the process recently, and it's fantastic. Okay, so I'm going to move us on. We're going to move on to a presentation from Simon and Shona about inequalities in physical activity. I know this will sit really at the top of our list. We're located in Darnall. A core part of the AWRC's vision is to tackle inequalities when it comes to physical activity. And many of us on the call across the research centres that are co-located at AWRC, this is a core part of what we do. So Simon and Shona, thanks ever so much for giving up some of your time to share this with us. So Simon, I'm handing over to you. Shona. Shona, do you want to give a bit of context?
Yeah, just make sure I've got, can everybody see Because there's two versions.
Got that, shown it, yeah.
Okay, and it's actually a slide presentation, not okay. So I'm going to start by I've been working in health inequality since the 1980s. And the bizarre thing is that it was Brits who were coming over and talking to us about it in Canada. So I've got a very long track record in this. And a lot of what Simon and I've been talking about in the last little while, particularly after that last piece of analysis he did, was I was going, yes, yes, yes. So we thought we'd do this together. We're going to tag team you. Is that word used here? That's again, the good old being a Canadian.
Yeah, tag team works.
And it doesn't seem to, because I have to get my finger on the slide. So the trick here is to not think, to recognize that the population is not just the sum of the individuals. I know that sounds absolutely counterintuitive, but if you don't wrap your head around that, you will always be making rather spurious assumptions about the population level effect. And so it's not the sum of individual health, and population health has become, some people want to say it's what public health has evolved into, but it's actually quite different than public health, which now tends to be about vaccinations, thanks to COVID. But population health is a framework for thinking about why some people are healthier than others. And that health is not due just to the provision of health services, healthcare provision. Over time, people die from has changed, but whatever people die of, poor people continue this to happen. But I was waiting for something like COVID, because when a new disease comes into the population, it's relatively egalitarian in the early stages and then quickly establishes a social gradient. So there's some jargon and they're not interchangeable. There's poverty is not the same as deprivation, is not the same as inequality. Poverty refers to a specific cutoff. You magically say people above or below this point are in poverty. Deprivation, I'll talk about a lot more. So we'll just leave for a minute. Inequality is the unequal distribution of advantage in public health, known as an area socioeconomic status measure, and it's not a substitute for an individual's measures of socioeconomic status. So why does this matter? It matters because health is socially stratified. It's not a case of poverty versus other. And regardless of the measure of social stratification that you use, you find a gradient. So it might be home ownership. It might be upper, lower, and middle class. We don't use the word class very much in Britain, probably because it's so embedded. Sorry, foreigner speaking. Education level, and it might be something around occupational prestige, and job titles have an occupational prestige. But these differences exist because health is due to more than the provision of healthcare and having enough money. Social factors play a significant role. It's been estimated by some of the people who've done some of the really big projects, such as Sir Michael Marmot, that social factors account for about 30%, healthcare for about 30%, and background physiology, genetics, and access to healthcare about 30%. So the social factors are a big driver. If you follow that link out to the YouTube video, it's a TEDx talk that talks about why this tends to happen. And advantages and disadvantages cluster. So they at any single point in time, advantages and disadvantages are there, and they accumulate longitudinally in your physiology. And there's a couple of other things at play. I would recommend always accessible. Have a look at the works of Bruce Lake or Joe Phelan. Sorry, that reference is not quite right. The attribution of their authorship's not quite right, but the rest of it's correct. Really stratified, and how it's about a whole combination of things. They write very well. And of course, of relevance to us is that the overweight obesity epidemic, what we have to remind ourselves is that obesity was previously a upper class affliction, we'll use that word, or consequence of the lifestyle. It is now a lower class consequence, and it is considerably well embedded, and you can watch the transition. How does this happen? It happens in a variety of ways. There is the income effect. I will never say that there isn't an income effect, but the income effect has decreasing relevance the farther you go up the socioeconomic scale. Living in poverty definitely can cause stress and anxiety, which damages people's health, which is demonstrated, well, it's not very well demonstrated in this diagram. And low income does limit people's choices, but there is a direct physiological effect that manifests itself more strongly the farther you go down the social scale. And the people at the bottom of the social scale are the people who are disadvantaged, the people who are poor, the people who are stigmatized in society, the people who are ignored. All right. And the farther you go down, there's a direct physiological effect. And we're beginning to map this. And the diseases that it maps onto, for which we have the best evidence, are diabetes, heart disease, and stroke, and probably dementia. And now we think possibly, or at least I think they will eventually clue in COVID. But what you have to remember is that there's a social class, a social hierarchy. It exists whether we acknowledge it or not. Okay, so it sits there in society. It is a concept, so it's a marker. It can be a difficult idea. One of the best ways to understand it is to talk to someone who comes from another culture, particularly one that's non-European, and ask them what could you draw a person who's high status or low status? Most people have absolutely no trouble doing that. And then you realize that having multiple wives or a Mercedes-Benz or a concrete floor are physical markers of social class. And then you can have these conversations. It is a cluster of factors, and with it goes expected behaviors. People behave like everyone else around them. And very few people travel the whole width of the social hierarchy. Okay. So when you measure it in your research projects at the individual level, you will be asking people about education and income. And sociologists always talk about occupational prestige, but it's difficult because occupations have different prestige for different genders, and some occupations that used to be very prominent no longer actually are, like stock traders. When you use the aggregate measure of socioeconomic status, which is the index of multiple deprivation that all our local authorities and our national government is so enamored of, a brilliant measure, I cannot argue that, but it is telling you the social circumstances in which someone lives, not their individual social position. Okay, so deprivation is a very well developed concept, and I think this is one of the best things that England actually has turned out. Scotland has a slightly different one, and I think Wales uses the English one, but it's defined as the damaging lack of material benefits. But when you go out and have a look at what the ONS says is included in deprivation measures, you will discover that it has 7 domains, which Simon's going to refer to, and that there are a whole bunch of things that why would they cluster? Why does having teenage pregnancies cluster with living in a violent area of violence and incomplete school attention and poor housing and all the other things that fall into the deprivation measures? It is relative. It's just simply designed to be a rank. It puts all 15,000 or just under 16,000 lower super output areas, census measure, into a hierarchical rank. So it is always relative. Somebody always has to be at the bottom, simply by definition. You could make that gradient shallower and everyone better off, but Britain hasn't quite clued into that sometimes. So there's an example. This is really old. This is from the East Midlands, where I used to work, and that is life expectancy on the vertical axis and a measure of deprivation. It is IMD, but just used in a funny way. And that funny little outlier at the bottom here, this one here with a very low life expectancy, is the local authority that had a Rotherham cigarette plant in it as its major employer. And one of the perks of the job was a free packet of cigarettes every day. So how do you apply these principles to physical activity? Simon. Oops.
Thanks, Shona. Afternoon, everyone. What I'm going to present to you is a few slides from a piece of work that we did for UK Sport and the 4 home country sports councils. Following the barbaric killing of George Floyd in America, the 5 sports councils decided that they'd do some research into tackling racism and racial inequality in sport. We'll share the presentation with you, and there's a hyperlink there to the full 27,000 words and 100 pages. Now, in the style of Chris Whitty, I've always been wanting to do this. Next slide, please. Okay, what you're looking at here is physical activity as measured by Sport England's Active Lives survey, split by ethnic group. And Shona, if you give me one click, please, to bring up the first animation. So what you're looking at there is 62.6% of the population in England, or the adults in England, are considered to be sufficiently active in the sense of meeting the Chief Medical Officer's National Physical Activity guidelines. And what we've done is we have conditionally formatted this by ethnic group. So Shona, if you can give me the second click. When we look at the category called Asian, and within it, Indian, Pakistani, Bangladeshi, and Chinese people, what you see is relative to the overall average, a sea of red, that levels of inactivity are above average, and consequently levels of activity are below average. And one of the key learning points that we got from this one was that describing people as Asian is a complete misnomer, because people from an Indian background are different to those from a Pakistani background, who in turn are different to a Bangladeshi background, and they have nothing in common really with people from a Chinese background. And we'll see that when we look at participation details. So this is the basic picture, that the white British population and white and mixed ethnic groups have higher participation rates than Asian people and Black African or Black Caribbean people. The Asian population in its totality is just over 50% of all ethnic minorities, and the Black African Caribbean one, for context, is about a quarter. So next slide, please.
Is that it? Yeah, that's it.
Thanks. What we're looking at here is ethnicity broken down by deprivation. So give me the first click, Shona. What we can see in that box is that the figure that really stands out for me is 31.1% of all Pakistani people in England live in the 10% most deprived locations. And if we add up across the piece, it's around 2/3 of all Pakistani people live in the 30% most deprived. We get lower but similar scores for Black African and Black Caribbean people. And if you click again, Shona, as a result, you can see that these groups are hideously underrepresented in the least deprived areas. Look at towards the bottom, whites and white British people, underrepresented relatively in the most deprived areas, and slightly darker green, overrepresented in the least deprived areas. Next slide, please. Now, what was interesting here was there are subtle nuances in participation. So give me the first click, Shona. We look at all ethnic groups. And now the second click. And what we can see here amongst South Asian, which is Indian, Pakistani, and Bangladeshi combined, is relatively low levels of walking for leisure, compensated by relatively high levels of walking for travel, low levels of cycling for leisure and travel, low levels of engagement in swimming and traditional sport, but relatively high levels of participation in team sport, notably football. And what this point raises for us is the issue of intersectionality, in the sense that what we found was that people from ethnic minority backgrounds were on average 10 years younger than their white British people. And we know that physical activity decreases with age, and therefore you'd expect for younger populations to have higher physical activity and sport participation rates. The opposite appears to be true. And then, without sort of getting into racial stereotypes, if we look at the Chinese people and we look at racket sport, we see 11.4%, which is more than double the national average. We look at swimming, we see that South Asian and Black people have much lower participation rates in that particular activity. So there's little point in areas with high levels of diverse ethnic communities saying, well, we'll solve this problem with free swimming. It won't work. The next slide.
And I also think that some of these sports are aligned to social class, social status. Yeah. Okay. Sorry. Sorry, Simon. Next slide.
Yes, please. And it's not just sport and physical activity. If we look at other cultural pursuits that people engage in, we see, with the exception of using library services, very similar patterns. South Asian and Black people are less likely to have attended a live sports event, various artistic activities and pursuits, or attending a museum and gallery. And that's sort of wider that I want to pick up on as we get towards the next slide, please, Shona. And these inequalities start early in life. What we're looking at here is physical activity in school age. Again, we see the Asian children, Black children, less likely to be active and more likely to be what's euphemistically described as less active. So it's not something which happens in adulthood. The seeds are sown a lot earlier. Next slide, please. And again.
Oh, sorry.
And again. Okay, this is the pièce de résistance, really. In what we did was we looked at activity and inactivity rates and then correlated them with the index of multiple deprivation. So you can see in the red box at the bottom that being active is negatively correlated, negatively and significantly correlated with the combined score for index of multiple deprivation across the 7 domains. And if you give us 3 more clicks, Shona, these are the other domains in which there is a significant relationship, significant and negative relationship. And if you just give me 2 more, we can also see that inactivity is positively correlated with education and people's living conditions, what we call locality. That means things like housing quality, have they got central heating, internally, externally, things like air quality. And so the key point that I want to make here is that inequality in sport and physical activity is not peculiar to sport and leisure. It is something which is deeply ingrained in societal inequalities. So there's no point doing interventions like free swimming, because what you need to be doing is a whole systems approach, which is where the work of Katie Schoen comes in. So next slide, please. And this is us pretty much done. So the take-home messages are: ethnically diverse communities are less physically active than white British people, despite being younger. So it shouldn't be like this morally, because we should all benefit from the physical and mental well-being benefits of taking part in sport. And statistically, it shouldn't be like this, because we'd expect younger populations to be more physically active. As you saw in Who Does What, different communities have different tastes and preferences. So let's not pretend all Asian people are the same and put on the same provision for all groups. It's not just sport. The inequalities are apparent in a wider set of leisure and cultural activities. They begin at an early age, and that activity and inactivity are correlated significantly with deprivation, and within deprivations, certain domains of deprivation. And final point is that these inequalities have their roots deeply engraved in wider societal inequalities. So when we talk about leveling up, we get some kind of sense of the magnitude of the task ahead of us. Next slide, please. I think that's us done. Thank you.
Great, thank you, Fiona, Simon, for that spotlight on inequalities. And with permission, I think we quite like to share the slides afterwards with folk. And I think as we continue the kind of spotlight series, I think Ed, this will probably fit really well into a spotlight on CRASA and the work that you do on those broader inequalities and some of the interventions that we might want to think about to tackle those and what they might mean for the policy agenda as well locally. So yeah, absolutely brilliant. I'm going to move us swiftly on to some brief updates from our research themes and programs. These are the broad areas of work that bring together lots of different research and innovation activity across the AWRC. Chris Dayson has had to send his apologies for a late childcare emergency, but he's said that he will provide an update at a future meeting, but that him and Catherine, who's Kath Homer, who's the co-lead, are open for business, and if you want to know more about their theme, just to get in touch with them. So Caroline, I'll come to you for your brief update, followed by Alessandro afterwards. Thanks.
Okay. I had I know we're not really supposed to, but I had a comment on Simon and Shona's presentation, which I thought was fantastic, and I wondered if you'd you don't have to answer this now, Simon. I wondered if you'd looked at the intersection with gender as well, because in the same way that you saw differences in ethnicity, like choice of activity, and also different participation levels, I thought that might be really, obviously, I'd be interested if you looked at that, really.
Well, I don't want to horn in on Simon's project, but I do think multivariate analysis needs to be done now.
I was just thinking, as a mum with 3 kids, the ability to be physically active if you like haven't always got access to a car is, you know, okay, you can take them for a walk, but blah blah. Anyway, right. So update. So in the living well with chronic disease theme, we've got our sub-themes. So just to remind you, here we got our 8 sub-themes, and I wanted to just share a diagram with you that Liam and where we go. Oh, let's make it a presentation. Should we do that? That'd be a good idea, wouldn't it? Oh, come on. Yeah, okay. So Liam and I found this rather funky diagram from some handbook or something, and this it sort of illustrates what we're trying to do with our sub-themes. So starting at the bottom, I don't know what I guess the little blobby things are a representation of connecting with people. So under each of our sub-themes, to try and start at the bottom and build a foundation where we build up relationships and sort of pull people in who are interested in working in sub-themes, then do some work on working out what knowledge we have, learning from each other, aligning, coordinating our work together, and then from that, developing collaborations, and we're producing outputs which like funding bids and that kind of thing. So this is sort of where I think represents quite nicely what we're trying to do. So under our sub-themes, then just down at the bottom left, I've got to remind you the color coding, producing, aligning, learning connections. So we've kind of got to different stages under each of our sub-themes. So we've got some sub-themes where we're still kind of making connections, working out who's interested and talking to people, so they're in the blue. And then in the turquoisey colour, we've kind of got a bit further where we've had meetings with people and groups and learning from each other and working out common interests. And then some groups have developed to sort of being more producing and putting bids in and things like that, which is in the light blue. So so I just wanted to highlight a few, not kind of do too much because I haven't got very long, so but just highlight a few things that we hope people might want to get involved with. So the Active Together thing, the cancer research around the cancer prehab service. So Mike and I had a really good chat today, and I think that there'll be some kind of event to for people who are interested in getting involved with that, to kind of coordinate how we work out like what samples we take from patients or what measures done, all that kind of thing. So if I'm sure everyone knows about that already, but just in case you didn't, with the neuro and the musculoskeletal groups, we went to RIS and they've scanned, done some funding opportunity scanning for us. So we're going to, we've got a Parkinson's disease bid in at the moment. So, sorry, my internet might be breaking up. I hope you can still hear me. Mike's working on, we've extended the long COVID pilot. So Mike's running a study with 100 participants at the moment on that. And then we had the NIHR bids in earlier in the year, which so the second one we were really irritated by, because somebody basically got funded for our identical project. So it was obviously a good idea, but at half the price. So I don't know how they were managing to do it for that. But anyway, one of the comments was you need pilot data. So we're getting pilot data so we can rework the bids. Liam and I got invited by Ollie Hart, our friend of the AWRC, to join the Healy Primary Care Network long-term condition steering group, and they've got various stuff that they would like, they've kind of invited us to be involved with. One in particular is they're rolling out patient expert groups where they give support and training to patient experts in, say, long-term conditions like, say, diabetes. And then when they have new people who are diagnosed, they slot them into a support group that is coordinated by a patient expert who's supported again by the primary care network. And they've tried pilot that in a number of practices, and they're rolling it out across the whole network. So there's a whole kind of they want us to be involved with that and evaluating it and all that kind of thing. And Helen Humphreys is also involved with that as well. And then I just want to flag up the metabolic conditions and mental health sub-themes, because we haven't really got involved with those, like developed those, but there's lots of AWRC activity already in those areas. So I think we'll be kind of working out how to not invade anyone's territory, but kind of collaborate, coordinate under our theme with what's already going on. Okay, I think that's all I've got to say. Is that okay? Does that make sense?
Thanks, Caroline. And if any of those areas of and the sub themes of kind of attention, then please drop Caroline or Liam a note afterwards. So Alessandro, I'm going to move swiftly onto you for your technological and digital innovations to promote independent lives, the practice.
Thank you, Rob. I'm sorry, I have a really bad connection, so hopefully I can do this. Be very brief. I will not show slides, so I can keep it in a few minutes. At the moment, the main activity is about restarting the study that we have at the Children's Hospital. So we are going to deploy our robots over there, working with your patient team to help to design a system that can help children, especially children with autism, in managing their anxiety before invasive treatment, like having the blood taken or a plaster cast, or orthopedic cast applied, and yeah, we are going to start in October, and this will be, I hope, the first of many collaborations with them. This is a project that unfortunately was on idle from March 2020. You all know what happened in March 2020, so that's I'm very excited to finally start the project. At the same time, October is a big month for me. 2 new projects are starting. The AWRC Network Plus about the use of robots to help people with frailty. We are a little bit on a delay because the coordinator moved from Bristol to Nottingham. So we're still waiting to start, but I will let you know because the focus of this network is co-creation and co-production. So definitely I will send out invitations for collaboration and try to use robots and how we can put our robots out from the lab into the real world. And at the same time, still in October is about to start on a European network this time, a Marie Curie network that is more general about personalization and use of robots. It also includes one of the researchers who focus on the AWRC priorities and will will program robots how can be personalized to help children with physical activity. In particular, the use of conversational agents and physical robots to help. I think these are the main things. I'll stop here. I'll give some 1 minute to James. There are some news as well. So James, please.
Thank you, Alessandro. Yes, so the company Fukuda, I don't know if you've heard, this Japanese company, they have operating worldwide, and they manufacture all these patient caring or patient monitoring systems. And through them, like they approach us, and then they want to develop a system which can wirelessly monitor the patient to make the patient move around in the hospital freely. But one of the biggest questions was about the security and privacy and so on. So how do we design a system so that we can monitor in a mobile mode these patients, and at the same time offload all the hurdles that the technician or the nurse has to manage or handle. So since they are a big company, they have to straight away start looking for what we call it, the Innovate UK funding for through KTP, but they were not allowed because it's a big company. So what we came out was there's another company called Will Do, Sheffield, a smaller company, and then they were allowed to start a proof of concept kind of idea to develop this technique. So they approached us, and then through them we started a SIP project just a week ago, and then it's going on. So they said if we can finish this within let's say October, the proof of concept, and design the application just to see how it can be done on a security and private to control that privacy and security model. So then if that is probably going to be successful, I'm already on the way, and it's really going really well. So by next month, if I can provide that system to them to the proof of concept, then from November, December, we want to put a full KTP in with the Fukuda organization. So that's one very interesting project that is undergoing at the moment. And another one short news is Timmy rang me up just a short while ago before we start this meeting. I don't know, Carolyn, if you remember the GTA, the application that we put in about the heart rate variability.
Yeah.
So Timmy said, so we are successful. We are one of the 2 candidates. So we have one GTA, and Timmy said he will email us out as well. So that was one good news. So one of the 2 GTA in computing, that was our group. So thank you very much for your time.
Great.
Thanks, James. So I will follow this because our proposal, mine and Jim, about the use of cybersecurity mechanisms to control the multimodal interaction of robotic and in general of conversational agents in healthcare settings, because of course, you may have experienced it, for instance, Alexa, and you can talk with Alexa. There is no security mechanism to make it secure the data that Alexa holds about you, so someone else can come, just speak with it, and know all about your diary or your medical appointment and things like that. And this proposal was selected for the SHU LTU joint PhD scholarship. So we are looking for a strong candidate, because this is very competitive. We are looking for a strong candidate with a background in computer science. So if you know anyone, please send it toward us, because we really want to start looking also this interesting area of research. I think this is it for us.
Alessandro, thanks.
Thank you. Thank you for listening.
Brilliant.
Can I ask one quick question?
Shona, I'm going to
no, okay, that's
no,
fine.
just because I want to give Rachel the last couple of minutes of the meeting, and I've chaired it really poorly in terms of timing. So perhaps drop it in the chat.
Yeah, no.
Shona.
Yeah.
Rachel, can I just invite you for final update on the neurological program? I think Rachel's with us.
I'm here, yeah, I'm just upstairs. Yeah, so we've got a couple of projects that have finished or are starting to close. So the Selfit project at Steps, which Nikki has led, I think the findings from that are really helpful. So that's closing now, and the Shape Master project with people with stroke, we just completed data analysis for that. So moving forwards into autumn, got 2 or 3 big projects or biggish projects running in the MAL, as I mentioned last time. So the first of those is the Magic 5, which is a contract research project with Shape Master, where we're using the motion analysis system and the CPET machine to better understand the biomechanics and physiological responses to power-assisted exercise. So we'll be recruiting 12 healthy or non-complicated older adults to take part in this project. I've already spoken with Dave Hembrough and Tom about potential connections that we've got to identify those individuals. But if you know of people who would fit that bill, aged between about 55 and 80, who don't have any significant health changes, then they would probably meet our inclusion criteria, and they would need to be willing just to tolerate having sensors applied and standing around for a bit in a vest and shorts whilst we get the analysis system set up. So if you know of people who might be a fit for that, then please let me know. Likewise, we're also recruiting research assistants to help with data collection as well. So they need to be master's level students with some knowledge of anatomy and ability to apply sensors, or to quickly learn to be able to do that and to collect the CPET data. So if you know of any postgrad students that might be looking for some casual work who would be available for that, then there's a job advert out with campus jobs, plus I've circulated to course leads, but just putting it out there as well if you know people who might be interested. The closing date for that is next week. So after a bit of shameless promotion for recruitment for the Magic 5, I'll move on to the MS Exoskeleton project, which is running with Sheffield Teaching Hospitals and also University of Sheffield. So 3 big organisations involved in terms of running this project, which will evaluate the use of an exoskeleton and compare it with an exercise intervention for people with complex changes associated with MS. So I think it's taken us into new grounds in terms of particularly information governance and data sharing. So both Shona and Jen on this call have been really helpful in terms of helping us to guide that. But what that should be is hopefully a template for future comparable projects, that I think once we've nailed it for this one, hopefully we can know how those systems can work, and that would apply for the future and be, I think, more efficient to just get off the ground. But recruitment should start this month, and I think we'll be welcoming those participants into the AWRC certainly by October. So they're the key data collection activities which are planned. we submitted to the Small Business Research Innovation Fund, so we should hear about that in a couple of weeks. And the focus of that proposed project was to look at improving the biofeedback on Shape Master equipment, so to introduce some limb isolation technology. So we are aware that it was a competitive call. I think a lot of people went for it, the stroke technology call, but if successful, then there'll be a big phase 1 engineering project. And if we go into phase 2, then that would be a fantastic implementation opportunity as well. I think it was really interesting looking at Caroline's connectivity diagram earlier on. And I think Chris and I have sort of regrouped and looked at the neuro program over the last couple of weeks and identified those turquoise green areas where we've got some real traction, some real developments which have progressed this year, and then those areas which are probably still sitting in the blue. And one of those is particularly, I think, the clinical service, the clinical rehab service that we plan to launch from the AWRC. And I think we'd like to move that closer to the top of our agenda over the next few months. So we've got a more firm plan for that going forwards as well. That's all. Thank you.
Brilliant. Thanks, Rachel. Some fantastic work. I have one just observation to close with, but does anybody have any other business? No. Okay, so I just wanted to close with an observation and just a reminder that the research, the activity that's been presented today, and the vast array of projects and agendas that we have going on at AWRC all come from different research centres and research groups from across the university. And the kind of the vision of AWRC to bring together these different research groups, these different expertise, from robotics to cybersecurity to rehabilitation to health economics, inequalities, population health, is it is really exciting to focus that expertise on a physical activity agenda. So this meeting's been a really good example of what the AWRC is trying to do in bringing together that expertise. And I'd like to thank you for your continued support and involvement in this project of the AWRC. And I'm really very excited about what this next phase, this next season might bring for us as we co-locate together on site, as well as the mixed digital economy. But please do continue to collaborate and to connect with one another. And if you want any further information, the SharePoint site for the co-locators meetings, Jen's done a fantastic job in pulling that together. I'm sure the link will be sent out with the minutes of this meeting, where you can hear more information and get the connections about all the people that are co-located across the AWRC. So we're 5 minutes over. I'll end it there, but thanks everyone for a fantastic meeting and your ongoing support for the AWRC, and enjoy the rest of the evening and the sunshine as what's left of it before the thunderstorms hits us at the end of this week. So, all right, cheers everyone. Thanks ever so much.
Bye.
Bye.
Bye. Thanks everyone. Bye.
Thanks all. See you soon.